Greetings, it's New Zealand naturopath Eric Bakker, author of Candida Crusher and formulator of the Candida range of supplements. This is a Blastocystis hominis series of videos that we're doing today. Have you clicked on the link yet? Please click on the link on your screen right now to download my free report. And don't forget to do my quiz on yeastinfection.org. I don't want to give myself too much of a plug, but my range of Candida supplements are fantastic for people with Blastocystis hominis and parasite infection in general. When I created the Candida Remove, I wanted to create the most effective and powerful broad-spectrum anti-parasite, antifungal, antibacterial product in the world. That's what I wanted to do. I just wanted to create something outstanding, something that really works time and again for all of my patients. You can find that product at canzida.com. That's with an X, canzida.com. So check that out, and that's going to help you a lot. We're going to talk right now about the unusual signs and symptoms of a Blastocystis hominis infection, okay? Because it's not all about the gut. Remember, the gut influences many different aspects of your health. We, in fact, call the gut the second brain. I haven't completed some videos yet on the vagus nerve and the autonomic dysfunction. I'm not going to confuse you too much with that now, but suffice to say, the gut has a big influence on the brain and on many aspects of our well-being. So when the digestive system is upset with blasto, you can get signs and symptoms throughout the body. Common ones I've seen, because I see a lot of people, well, I should say less common. You may not experience these, but some people will really relate to these. You may have a digestive problem, but you also may have very itchy skin. You may have joint pain. You may have one finger joint that occasionally hurts. You could have brain fog. You could get all sorts of sharp shooting pains throughout the body. You could get all sorts of muscle twitches. You could get urticaria. Even hay fever and various kinds of hypersensitivity responses are linked up with blasto. So now you're thinking, well, hang on a minute, this sounds like a load of baloney. How can that be? Well, when blasto affects the body, it affects the immune system. When the immune system is affected, the immune system can create all sorts of chemicals that have peripheral effects all over the body. In the brain, in the central nervous system, in the peripheral nervous system, in the skin. Many organs can be affected. So the whole body can be affected when the gut's been affected. Particularly when the digestive system's been affected for a number of years. You can get a lot of strange peripheral symptoms. And you go to the doctor and that'll be seen as a separate disease. So then you'll get more drugs for those, diseases that the doctor has got no clue about. Ask yourself this question. This is very important. I want you to pay attention. The symptoms that you've got that are unusual, did they come after digestive system symptoms? So did you, a long time ago, develop gut complaints and then over a period of months or years develop other symptoms on top of that? Those are the sort of things I look for when I have a patient who's been chronically unwell for years. Because chronic disease is a progression, it's a development. Okay, a ladder develops over a period of time, so we get symptoms here, symptoms here, symptoms here, and they just progress. Unfortunately, the medical profession sees all these symptoms as completely unrelated, and each symptom gets its own drug, which to me is just crazy, because chronic disease has an origin. And if we really carefully peel back the layers and look at the beginning and treat that, we can often clear up all of these other symptoms that came. Isn't that common sense? To me, it's just common sense. But for the medical profession, it means all these additional drugs are given to you, which create additional side effects. So remember, blasto can create gut problems, but it can also create a lot of peripheral problems as well. All right? Have a think about that. Thanks for tuning in.